and we're going to take you on an adventure of health today, as we always do. As you know, we always have doctors on the program about 90% of the time, but this evening we're lucky to have a CEO of a hospital. So a lot of questions about his hospital to ask, to learn a little bit more. The hospital's Florida Medical Center, a campus in North Shore. It's located in Fort Lauderdale. You'll probably recognize the name of the hospital because we've had many doctors on the show from that hospital. But without further ado, I want to introduce Mr. Mark Racicot. He's the new Chief Executive Officer of Florida Medical Center. Mr. Racicot, welcome to the program. How are you doing this evening?
I'm doing great. Thank you for having me here today.
And thank you for joining us. This is great. We don't always get a CEO in the chair, like I said, so really excited to have you. Now, I know Florida Medical Center as a heart hospital. Before I got into healthcare PR, actually driving by on the turnpike, I would always see the Heart Institute of Florida right there. And as I got into working for a hospital group, I learned a lot about the hospital. Is it still known as a leader in heart care?
Yeah, it absolutely is. The hospital opened its doors in 1973, and a year later was the first hospital in Broward to do open heart surgery. And I think it's really built on that reputation and history for the next 44 years, and it continues to have state-of-the-art heart procedures, great doctors that specialize in cardiac care, and I would definitely consider it one of our strongest service lines.
So the first open heart surgery in Broward County was done at Florida Medical Center.
That's true.
Wow,
yes,
that's great.
Yeah,
that is a pioneer in heart surgery. And today, I read a little bit online, but I wanted to ask you a little bit about it. You have a heart valve clinic at the hospital that is functioning today?
No, we don't have that today, but we're on our way. There are a couple of things that we're working on, some new technologies that are coming in that will result in us having that clinic, and we do intend to have that very, very soon.
Okay, so that's something on the horizon.
Yes, sir.
A heart valve clinic. Now, there is, I want to get this right, though, there is a cardiac hybrid operating suite and a cardiac cath lab being used at the hospital.
There's actually 3 cardiac cath labs at the hospital. We have 3 cardiac cath labs. We do have a hybrid OR suite that we do a lot of cardiac work in, but we go beyond cardiac in that room. And we also have an electrophysiology lab that just opened up last year. So we really have, the whole gamut of minimally invasive heart and cardiac and vascular care, which really sets us apart, and it's where the future is going. There'll always be the need for the open heart and open cases, but over time we've been able to really do a lot as far as minimally invasive work goes, and that's where the cardiac cath labs and the hybrid room come into play. It allows us, basically to get inside the heart without opening the patient up, and through advanced imaging and technical systems, they're able to go inside, diagnose, and treat problems that the patient sometimes gets to go home that same day. Minimal incision, less pain, less discomfort, and it gets them home.
It's amazing the way medical technology is moving. We've had a few of the heart specialists from your great hospital on the program, and the way they talk about these minimally invasive procedures, it just amazes me because in some cases, like you said, some cases are still need to, be an open heart case, but I had one doctor tell me about a procedure that may have just a few years ago would have been an open heart procedure. Now they're able to go under the rib with just a very small incision. And then the key word that you mentioned there, electrophysiology, I didn't even know that existed until recently. So that's like an electrophysiologist, correct me if I'm wrong, is like an electrician of the heart?
Exactly. What the EP lab does, it's kind of a variation of the cath lab. It falls under the cath lab suite at the hospital, but it's where we are able to diagnose and treat the electrical system of the heart. You hear about irregular heartbeats and AFib. And these are conditions that now through minimally invasive technology, we're able to do ablation procedures that correct those electrical deficiencies and let people live a normal life.
That's great news. And I'm here with Mark Racicot. He's the CEO of Florida Medical Center, a campus of North Shore, located in Fort Lauderdale. Mark, tell me a little bit about what types of heart specialists are on staff at the hospital. I know you mentioned electrophysiologists. There also are cardiologists.
We have general cardiologists, interventional cardiologists. We have cardiac surgeons. We have thoracic surgeons. We have vascular surgeons. We have electrophysiologists. It's really, we've got the whole gamut. It's, you know, I've only been at Florida Medical Center for about a month as the CEO, and it's really every day it's eye-opening to me what a gem I've been fortunate enough to take over and lead, because it has so much going for it in terms of the types of care that we can give. Our whole cardiac team, we have very established doctors in the community, as well as we have some new doctors coming in who have had exceptional training, and they're ready to go and take a leadership position here in this market.
And it's a big hospital. I've been over there a few times and kind of going through a renaissance. It looks really great. So tell me a little bit about your history. What brought you to Florida Medical Center? How long have you been with Tenet? Where were you before?
Kind of a funny story. I don't know how many, it's probably not the typical path of a hospital CEO. My background is engineering. I'm a civil engineer. I went to school in Massachusetts, born and raised in Massachusetts, went to the Worcester Polytechnic Institute and got a degree in civil engineering. Over the first 10, 12 years of my career as a consultant, I did a lot of work in the healthcare arena in Massachusetts. Some of the Boston hospitals we did projects in, and there was something that always just fascinated me about it. And then I had an opportunity to become a facilities director at a hospital in Rhode Island, and I jumped on it, and that totally changed my career. From there, I joined a hospital in Massachusetts that at the time was a Vanguard hospital. I was the director of facilities, became the director of support services, and then an associate administrator of one of the hospitals. And in that time, Tenet acquired Vanguard Health Systems. So, you know, my corporate ownership changed. And back in 2015, at the end of 2015, I was given the opportunity to come down to Florida to Palmetto General Hospital as the chief operating officer. And, you know, that was a big decision for me, but it was the right decision to come down, and it was an amazing experience, 2.5 years at Palmetto under by far the most talented chief executive officer that I've ever worked with in my life. I learned so much, and then when the opportunity came to follow Trey Abshire at Florida Medical Center as he moved on to Palm Beach Gardens, it was a no-brainer for me to come, and so here I am.
Great move, and we're glad to have you. And a couple of things there. I was actually born at Palm Beach Gardens Medical Center, where Trey is now. Wasn't a Tenet hospital at the time, but I always like to throw that in. And you'll remember Trey Abshire was on this show last December. It was a great show that we had him on. And again, Palmetto General Hospital, that is a great hospital in Miami-Dade County, Hialeah. Another large hospital as well. Great medical plaza right next to it. I know a lot of physicians are in that plaza. We've had a few on the show.
Right.
So that was a great stepping stone to get to where you are today.
Yeah, definitely. And you know, really a lot of the things that I was able to be part of at Palmetto, I certainly am looking forward to trying to bring to Florida Medical Center and you know, create similar situations.
That's great news for the Broward County community and Fort Lauderdale as well. Lauderdale Lake's right there, too. Really close to the Palm Beach County line as well. We talked a little bit about the heart care available at Florida Medical Center. I also read that it's a comprehensive stroke center, and I read a little more into that. It's a little different. There's comprehensive stroke centers and primary stroke center. What is the difference, and why is it important to, if you can, get to a comprehensive stroke center?
Well, I got to tell you, nothing, stroke is a very, very scary and serious condition, and it can be absolutely devastating to those that suffer from a stroke. And they say time is brain. The sooner that you can get that stroke treatment, if you will, the better your chances of leading a normal life, afterwards. So what a primary stroke center does is it has the ability to administer clot-busting drugs, TPA, and there are really two types of strokes. There's the clot, and then there's the actual bleed. So in a primary stroke center, that's the type of center that focuses on the clot stroke. A comprehensive stroke center is able to, through interventional technique, go in and take care of the bleeds as well as break the clots. So it's really a higher level of care. It's the ability to go after different types of strokes. We have to have an interventional neurologist available 24/7, which we do. We have to have a neuro-intensive care unit for the follow-up treatment, which we do. So to have a comprehensive stroke center, all I can say is if God forbid I was to ever have a stroke or one of my loved ones, I would want them to be at a comprehensive stroke center. It would give them their best chance, and I think it's very important for the public to know the difference. It's a great question.
And Florida Medical Center is a comprehensive stroke center.
Absolutely.
The website is floridamedcenter.com. So Florida, medctr.com. There's a ton of information there on the website. Florida Medical Center is located at 5000 West Oakland Park Boulevard in Fort Lauderdale. Number's 954-735-6000. That's 954-735-6000. And I'll give out that information again before the end of the show. We have about a minute to take a quick commercial break. I was wondering if talk quickly about ER Check Online. You can check online before you go to the ER?
Yeah.
How does that work?
It's pretty cool. It's the website that you gave the address, floridamedctr.com. You can click on the online check-in. I think nobody likes to wait. That's the biggest complaint that anybody has when they have to go to an emergency room, is they know that they're probably going to be there for a long time in relation to the amount of time that they're actually being treated. So what the online check-in does is it enables somebody, who's not in an emergent situation but still needs to go to the emergency room to essentially make an appointment online and have less of a wait time, more convenience for that person to come in, have their work done, and get out with minimally screwing up their day.
That's great. We're going to take a quick commercial break. On the other side, I'm going to ask Mr. Racicot a little bit about robotic surgery options available at Florida Medical Center.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments and my curveball question of the hobbies and passions in life. doctors pursue when not providing medicine. And now back to how to stay healthy, your weekly doctor's interview and prescription to better health. And welcome back, South Florida. Today we have a CEO on the program, Mr. Mark Racicot, CEO of Florida Medical Center, a campus in North Shore located in Fort Lauderdale. Mark, before the break, I was asking you, or I was teasing a little bit about robotic surgery. Now, this is something I feel like is completely new. Tell us a little bit about the robotic surgery options available at the hospital.
Well, I think the theme that we've been kind of covering for the first 15 minutes has been minimally invasive and state-of-the-art technology, and that certainly is what robotic surgery is all about. Florida Medical Center is one of 45 robotic surgery centers of excellence in the country, so we're very proud of that distinction. We have two Da Vinci robots that we use, once again, it's just where technology has taken us. We're able to use robots to make smaller incisions, to be more focused, to cause less pain and discomfort for the patient, less opportunity for infection, less opportunity for transfusion, and again, they get home faster, and that's really what it's all about, giving the best care we can to our patients. It's truly amazing. I've had the good fortune to be able to go in and observe a couple of robotic cases along the way, because I really didn't understand what they meant by robot surgery. I didn't know if, really what it meant. And when you really get to go in and see how the technology and the tool works, it's unbelievable to see what we can do. And we can do so much with those robots. We can do bariatric surgery. We can do colons, gallbladders, hernias, hysterectomies, you name it. And it's something that, it's not always the right solution for a patient. It has to, the doctors must decide whether or not the patient's a candidate for robot or if open surgery is better. But it really has opened up a lot of opportunities for patients as well as for hospitals such as ours.
You could say it's another tool in the toolbox of care for surgeons, because they have that option. Like you said, if these surgeons are trained to do open, but nowadays there's additional training in the robotic surgery as well, so it's a different option. And like you said, I actually had a chance to see one robotic surgery, and then actually they had the Da Vinci, wasn't the one at your hospital, but like one you could test drive, and I'm doing that with my hands. And it was really neat to see. If you ever have a chance, if any of the hospitals offer it, anyone should go check that out, stand in line, and then you'll really get a sense of it. And one last thing about robotic surgery, I've had a lot of surgeons on the show, and they've told me that it can kind of save on the wear and tear on their body, because laparoscopically there's a lot of angles that they would have to get into to access different cavities in the body, and it's kind of saving the wear and tear on them. So that's good for you as well, being a CEO, kind of, keep those surgeons fresh.
Keep them fresh and keep them going the longest. That's right.
As well, and minimal incisions too. So that's always important. That sounds good to any, one in the community as well. Absolutely. You mentioned bariatric surgery. And we've had Dr. Fernando Bayron from your hospital on here 3 times. And I know your hospital, Florida Medical Center, is a surgical weight loss center of excellence. I just think I read in the news he just celebrated his 1,200th surgery or something. And that's huge to have a surgeon of that caliber.
Yeah, he's something else. He's an amazing surgeon. Every day when I look at that OR schedule, he's chugging along. He's got a lot of patience. He's got great quality, and bariatrics is definitely a focal area that he's interested in, as well as the hospital's interested in. And that's the way the Center of Excellence works. You need to have great surgeons that can do the work, and then they need to have a place where there's exceptional care, aftercare, and even in the case of bariatric, before the surgery. It's a growing market, definitely. I think that science has proven that some of the traditional weight loss techniques of exercise and eating less sometimes just aren't enough. And bariatric surgery gives patients an opportunity by reversing the obesity, they're able to correct a lot of secondary health problems caused by that excess weight, such as diabetes, so on and so forth, high blood pressure, and again, live a happier, healthier life. So it's a wonderful option.
And it saves lives, most definitely. And like you said, it's a whole program. It's not something that you can just wake up the next day and snap your fingers and ready to have bariatric surgeon. There's dietitians involved. There's a whole team-centered approach.
Yes.
That's what I was getting to.
Yeah, it takes a little bit of time, but you got to find the right candidate patient.
Now, I'll switch gears a little bit and talk a little bit about orthopedic surgery, because I know, as well as, you know, being a bariatric surgical weight loss center of excellence, a great heart hospital, a great neurology hospital for stroke. I know a lot of primary care physicians. I know that 3 endocrinologists in the last few months have joined your staff as well, which I'm going to get into. But it's also an orthopedic center as well. There's a lot of arthroscopic surgeries going on, I guess, for the shoulder, knee, elbow, and hip,
right?
Well.
Once again, you know, we run the gamut when it comes to orthopedic. We do total joint replacement. We have designation as a Joint Commission Center of Excellence, I guess, for hip and knee replacement. One of 3 in Broward. You know, so that's, again, a great distinction for Florida Medical Center that I'm very proud of. We do, you know, total joint replacement. We do the sports medicine, the arthroscopic, the ligaments, and so on and so forth. We do the full range. We can do hand. We can do, you know, a lot of spine work that our neurologists can do as well. So we do have a full-scale ortho program. Then we have the aftercare through our rehab department that's right on essentially the same parcel of land, the same campus, and they do exceptional work in trying to get people back to their full range of motion after their surgery.
That's great as well. And if you want to check out any of the services Florida Medical Center provides, you can just go to floridamedcenter.com. That's floridamedctr.com. There's a ton of info there. Let's go a little bit offside of the campus of Florida Medical Center. You also have an emergency center in Davie.
That's right.
I've driven past it. I've seen it. It's virtually brand new the last few years, right?
It is. I think it's 3 years old at this point.
Tell us a little bit about that, and why does the hospital have an emergency center in Davie? I think people would ask that.
Well, you know, it's interesting because coming from Massachusetts, there were no such things as freestanding emergency rooms. So that was something that was new to me when I came down. Florida does have the freestanding emergency room, and you know, it certainly is not. It took me a little bit of time to realize we're not talking about an urgent care center. Very, very different. The freestanding ER is a full 24/7 full-service emergency room. We have imaging capabilities. We have a CT scan. We have X-ray machines. We have a lab. You know, we're able to do anything that you would go to the emergency room for. So it really gives the hospital an opportunity to expand its presence, you know, again, within its service market area, if you will. I think that's what we've tried to do with our Davie site, is to just spread ourselves out a little bit and give our patients an opportunity. You know, it is less of a wait. You know, at this point in time, it's 10 beds, and usually the wait time is minimal there. So it's an opportunity and a choice for our patients who might need to go to the emergency room and say, okay, maybe instead of going into the main hospital, I'll take a ride out to Davie and get my care there instead.
Nice. That is a great option as well, to have the emergency center of Davie. And there's some more information on the site, on the website as well. I want to ask you, you're having a big back-to-school event there on August 4th at the emergency center of Davie.
Yes,
correct?
We are. Yeah, it's you know, we like you said, we're 3 years young, And what we wanted to do was just kind of have a community get together and reintroduction to the freestanding ER. So on August 4th from 1 to 4, we will be having that event, and it's a great time for kids to come out. We'll be doing bike helmet safety. I believe anyone that goes to our website right now and sees there's an RSVP phone number, the first 100 people who RSVP to the event will get a free backpack. We'll have health screenings, we'll have food trucks, and it should be a fun day for everyone.
That's great. And again, FloridaMedCenter.com. That's FloridaMedCTR.com. And you can find out more information and register for that great event as well. We only have a minute, Mr. Racicot. I just wanted to ask you, what are your hobbies and passions in life outside of leading a hospital? I mean, it takes up a lot of your time, I imagine.
Well, I got to tell you, I'm an outdoors kind of guy. And that's one of the greatest parts about moving to Florida is able to enjoy that summer weather year-round. You can go golfing one day, go to the beach the next day, and take the boat out the next day, and really just enjoy the Florida lifestyle because up in Massachusetts, we only had it for about 3 months a year, and the rest of the time we were bundled up inside our houses. So it's really a nice change to be down here.
Well, we're glad to have you here, and thank you for telling us so much about your hospital. Really
Thank you for
appreciate
giving me
it.
the opportunity. I really appreciate it.
Again, it's FloridaMedCenter.com, FloridaMedCTR.com, 954-735-6000. Thank you, South Florida. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors. All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only